and we will kick this webinar off. So welcome everyone, and thank you so much for joining us today. I am Kate Marple from Who Tells the Story, and I'm part of the training and technical assistance team for Kaiser Permanente's Health, Housing, and Justice Medical Legal Partnership initiative. I have the privilege of moderating today's conversation. And before we get started, I just want to go over a few housekeeping notes. So first, this session is being recorded. And so we're going to send the link, the recording link, and all of the resources that are discussed on today's webinar to you in an email after the session wraps. We are expecting a pretty large group today, so please stay muted while others are speaking. You can use the chat box both to ask questions and to engage in other ways throughout today's webinar. Lastly, there are going to be several opportunities during today's session to ask questions of our speakers. So if you have a question at any point, don't wait. Please go ahead and put that in the chat box, whether it's a question for one of our speakers or whether it's a question about the project or a resource that's mentioned in general. Kyron Pierce from Health Begins, who is my colleague on the training and technical assistance team, is also my co-pilot for today's webinar, and he is going to be staffing the chat throughout. So let's go to the next slide, please. Before I introduce our first speakers, I just wanted to take a moment to acknowledge everyone who's in the room joining us today and really what is bringing us all together. So I have this quote from Matthew Desmond up on the screen, the founder of the Eviction Lab. And he wrote in his book that without stable shelter, everything else falls apart. He meant that really literally, right? That if we think about all of our most basic needs, housing is really the hub at the center of those spokes. So many of our needs revolve around housing. But he also meant it in a much larger and deeper way too. He went on to write in that book that home is the place where we take our masks off, the place where we are free to be all of ourselves and to be all of our identities. Home represents a chance for safety that goes well beyond the physical. We had about 900 people registered for today's webinar. And I know that some of you have worked in the medical legal partnership field before. Some of you are relatively new to this work, and some of you might be hearing about it for the first time today. But I know from our registration data that housing is part of the work that all of you do in different ways, and that you are community organizers, frontline service providers, policymakers, funders, and researchers. And we also know that we have a pretty even split of people joining us today from the health, public health, legal, and housing worlds. And given your backgrounds, I imagine that when you think of housing, you are driven by one of or more of these imperatives, that housing is a health issue, housing is a social justice and human rights issue, and housing is an equity issue. These missions that we share to realize health, justice, human rights, and equity in housing for all people overlap, and they shouldn't be siloed. Neither should our efforts to achieve them. And that idea that all of these missions are intertwined and are served better when we approach them in tandem is at the very heart of medical legal partnership and at the heart of the Health, Housing, and Justice Initiative that you are going to hear about today. Let's go to the next slide, please. So that brings us to today's agenda. The Health, Housing, and Justice Project is a first of its kind initiative in that this is the first time a health system has invested in medical legal partnership, both system-wide and across multiple states. And as we talk about this work today, I also just want to acknowledge both the National Center for Medical Legal Partnership and Health Begins, who are the training and technical assistance partners in implementing this initiative. So during today's webinar, you're first going to hear a little bit about why Kaiser Permanente chose to invest in legal aid and a little bit of background on the program itself. Then we will hear about the results from the initiative's robust implementation, training, and outcomes evaluations. We will also hear from some frontline practitioners about their on-the-ground experiences leading these programs in different regions. And as I mentioned at the top, there will be dedicated Q&A time, and we're going to do it in between each section of speakers rather than waiting till the end. So keep those questions coming in the chat box throughout. And then finally, at the very end, we will zoom out a bit and hear about ways to sustain and grow this work both at Kaiser Permanente and beyond, and ways everyone here today can break down silos between the health and legal worlds. Next slide, please. It is now my great pleasure to welcome Pam Schwartz and Marissa Connor from the Office of Community Health at Kaiser Permanente to share a bit about why KP took on this initiative and how the program has taken shape. So Pam, I'm going to hand it over to you first.
Thank you, Kate. And hello, everyone. And thank you so much for being here today. My name is Pam Schwartz, and I'm an executive director at Kaiser Permanente. And I'm thrilled to be part of this webinar today, where our team is going to be highlighting the transformative impact of Kaiser Permanente's medical legal partnership. This is one of our key strategies to prevent homelessness and also increase housing stability among our members, our patients, and our communities. And this was already said by Kate, but just to reiterate that Kaiser Permanente believes that housing is health and that everyone deserves a safe, stable place to call home. And to that end, our Housing for Health team is working hard and has been for years to prevent and end homelessness, and doing this through policies, investments, and also programs. And today we're here to talk to you about an incredible program that prevents evictions and also advances health equity. And we believe that if we can prevent evictions, we can make a meaningful difference in people's lives and also a measurable impact on their overall health. And we know that evictions cause devastation. Kate also said this. We know that tenants risk experiencing homelessness. They risk negative physical or mental health consequences, even unemployment loss. And also, people who are threatened with evictions are more likely to report poor health, including things like high blood pressure, depression, anxiety, and infant mortality. And also, this was also said by Kate, that these consequences are not experienced equally. We know that housing instability is also a health equity issue. And as a result of historic and deep-rooted inequities, we know that people of color, people with mental illnesses, and LGBTQ plus people face disproportionately high rates of evictions and also homelessness. And then to address housing instability and prevent evictions among our members and our communities, Kaiser Permanente was proud to partner with the National Center for Medical Legal Partnerships and Health Begins to establish the Health, Housing, and Justice Medical Legal Partnerships Initiative. And what we've learned through these partnerships won't be a surprise to this crowd, and Marissa is going to talk more in depth about this, but we're going to talk about things like how legal help can make a difference when it comes to tenants staying in their homes and avoiding displacement or homelessness. And our medical legal partnerships here at Kaiser Permanente works upstream to really embed access to legal services into our healthcare settings, and this is helping to prevent legal crises like evictions even before they occur. And since 2021, Kaiser Permanente has made significant investments in medical legal partnerships in 5 states, and we've recently committed an additional investment to expand access to legal services to new communities, all by next year. And by expanding our investments, we're bringing critical housing-related legal services to our members, our patients, and our communities. And we're proud to be helping prevent evictions, also to increase housing stability and improve health outcomes, as I already mentioned. And with that, I want to welcome Marissa Connor. And Marissa has been doing an amazing job leading this work here at Kaiser Permanente, and she'll share with you more details about the initiative. And also she'll give you a flavor about what we've learned over the years as we've been embarking on this for several years now. And again, thank you for joining us, and over to you, Marissa.
Thank you so much, Pam. Next slide, please. So as Pam was saying, we launched this initiative in 2021 in partnership with the National Center for Medical Legal Partnership and Health Begins. And what we've learned through this initiative is that we can really embed access to a highly skilled attorney to really maximize this highly specialized and scarce resource by going upstream through our MLPs and identifying a patient's legal need before it's a full-blown crisis. And since we've launched this initiative in 2021, we've not only established MLPs across the KP healthcare system, but we've also supported with building the capacity of the broader legal aid ecosystem. And as you can see from the map on the next slide, you want to shift one over on the next slide, please. So like I was saying, we initially partnered with these local legal aid organizations across 5 states to connect our members who are at risk of eviction or experiencing housing instability with a legal aid attorney. And we are so thankful to our pioneer organizations who are listed here for partnering with us since the beginning. And as Pam shared earlier, we are continuing our investment in the legal aid community and expanding to new regions and communities. And this slide here really shows the full network of our health, housing, and justice legal aid organizations. And through this expansion, we've recently launched an experiential learning lab to share some of the learnings that we'll discuss in this webinar with the 15 new legal aid organizations that we've partnered with here. Next slide, please. So in this next session, we'll transition to discussing the data and evaluation findings from this project. And I wanted to note here that there were 2 separate evaluations of the MLP. So one focused on patient outcomes and one on implementation. So I'll start first with providing an overview of our implementation evaluation. Shane Mueller from KP's peer team will discuss the evaluation findings that highlighted the impact of our MLPs. And then Alejandra Cabrera of Health Begins will provide a summary of a training standardization project and how this project led to the creation of additional training resources. Next slide, please. So the implementation evaluation was a 2-year evaluation that was conducted by KP's Center for Community Health and Evaluation, and really looked at the barriers and facilitators to establishing MLP processes and also changes to KP staff and system capacity. And our final report actually came out in January, but because of our role in supporting the implementation of our MLPs, we really tried to report findings periodically over the past 2 years in the spirit of continuous improvement, and so that these findings can inform some of our current practices. And the evaluation team conducted interviews and surveys with KP clinical as well as non-clinical staff, legal service providers, as well as the training and technical assistance team from NCMLP and Health Begins. Data sources also included review of administrative data, as well as observation of program activities. Next slide, please. So our first finding is that the KP MLPs really helped a lot of people and expanded access to legal services. And in speaking with attorneys, several noted that the clients they have served through the MLP might not have reached them through other channels. Either way, they would not have met their intake criteria, or they just might have been able to make contact with them in the first place. And so notably, some of these attorneys said that they were able to serve a particularly vulnerable group of patients through the MLP, in particular, people who were dealing with a significant medical challenge, for example, in addition to challenges relating to poverty or housing instability. And staff on the KP side also corroborated this, saying that often the patients they were working with, they don't sometimes think of access to legal services as something that they're able to really gain access to. And so the MLPs created opportunities for collaboration on cases where especially we're citing that patients' needs were often complex. And the quote here on the slide is from an MLP attorney, and this really illustrates how the social work expertise of the KP staff members can really act to supplement as well as complement the legal expertise that they're able to bring. And so one example of this is, there might be a patient who has received an eviction notice from a landlord. And then after the KP care team member refers this patient to the MLP, an attorney could then step in and negotiate a delay while a social worker can work with that patient to get them access to money for rental arrears or perhaps help them find a less expensive place to live. Next slide, please. And so the second finding is that our MLPs really started out with 4 active sites in Sacramento, Vallejo, Baltimore, and Portland. And in the spring and summer of 2023, we expanded to 2 new sites in Colorado and Los Angeles. And so this key finding here is that those 4 initial sites really worked through a lot of messiness, did a lot of troubleshooting to really establish MLP policies and procedures, and those new sites in Colorado and Los Angeles really benefited from a lot of those early sites and their lessons learned. And so some of the infrastructure of the expansion sites included things like early onboarding to KP's social health referral platform as really the main source of referrals for our MLPs across all of our sites. High quality trainings were informed by the experiences of our KP staff and our legal teams, and we'll dig into a little more in some subsequent slides. Also, we implemented the use of what we're calling a smart phrase, and the team in Sacramento actually developed that smart phrase for MLP screening and implemented this within KP's Health Connect, which was also shared at other sites. And then lastly, we were able to really streamline the workflows that we developed by these first 4 sites. And they were documented and organized by our training and technical assistance team at NCMLP and Health Begins into a really nice one-stop shop web-based platform that we're calling the Implementation Library. And so this table on this slide here shows that all 6 MLP sites and their total referral numbers, and then also shows the number of referrals that they made within the first 12 weeks on KP's social health referral platform. And so along with Sacramento, which was very successful early on, Colorado and Los Angeles generated also a good number of referrals right out the gate. And next slide, please. Awesome. And so this slide here covers the facilitators that really rose to the top in aiding implementation of the MLPs across that tier evaluation. And so first is the development of a shared vision between KP and legal partners, and we cited this as something that was critical. This also led to forming a trusted partnership in the long run, which we found is really key to longevity and sustaining those referrals. Next, having a social health screening protocol really continue to foster patient comfort with disclosing information for referrals. And we found this was really key in identifying patients who were in need of a referral. And lastly, development of information sharing and consent protocols allowed for direct collaboration between KP and the legal partners, and again, continue to foster that trusted bond that was developed since the beginning. And then next, I'll go into more of the training and the development of these effective trainings really focused on MLP procedures, patient identification, and housing-related laws, which I'll talk a little bit more about on the next slide. I want to shift one more. So overall, training for KP staff, we found really increased their screening as well as their staff knowledge. Kaiser Permanente frontline staff reported that these initial trainings really provided just enough information to be able to make appropriate referrals to the legal teams. We also established consistent opportunities through things like office hours and curbside consults, which really provided opportunities for continuous learning, which supported growing their ability to identify and make appropriate referrals. And then like this quote from one of our KP staff illustrates, staff reported that having this resource, having access to an attorney, it really greatly increased their sense of efficacy. For example, they don't feel completely in the dark when it comes to supporting patients with housing-related issues. And through the MLPs, they have an attorney that is embedded as part of their care team that can support when a patient is in need of housing-related legal support. And I think with that, I'll pass it off to my colleague Ale, who will continue discussing some of the standardized trainings that were developed and what that process looked like.
Thanks so much, Marissa. Before we hand it over to Ale, I just want to do a couple of quick of notes here. For those of you who have been asking questions of Marissa in the chat box, we have them. We're going to hold questions until all 3 of our data speakers have gone, but we will ask them, so keep those questions coming. I also want to note that Kyron is sharing 2 resources in the chat box that relate to Marissa's presentation. So both a sample MLP workflow training, as well as a job aid that helps healthcare and legal teams understand, when to seek patient consent to share information and how to document that. And I want to shout out Mallory Curran here, who is a senior consultant with the National Center for Medical Legal Partnership and part of the training and technical assistance team, who really led the development of the patient consent materials and many of the workflow materials that we're sharing in the chat today. So take a look at those, and we'll also be circulating them at the end and again in email. So if you miss them in the chat, don't worry about that. And with that, I'm going to hand it over. We can go to the next slide, and I'm going to hand it over to Alejandra to talk about the training work.
Awesome. Thank you so much, Kate. And thank you all so much for being here. Really excited to share an overview and some insights we gathered through our training standardization project that we launched earlier last year. So because of all the amazing work that the KP implementation evaluation team did throughout this initiative, which Marissa spoke to in the previous slides, we really were able to hear from and learn from the healthcare staff and the legal aid staff that there was really a need for more trainings on housing-related legal topics. So in February of 2023, the Health, Housing, and Justice Training and Technical Assistance team launched a training standardization project. And I just want to give a huge shout out and kudos to Kate, who is our moderator today, who really helped lead this project in the back end. So for this project, basically once a month during office hours, legal teams at all of the active MLP sites trained Kaiser Permanente healthcare staff on different housing topics using the same materials. And so through this project, as you can see on the slide here, we had 3 overarching goals. So one goal was to increase Kaiser Permanente care providers' awareness and knowledge about specific housing-related legal topics. The second goal was to increase quality referrals to the curbside consults with the legal teams, the MLP legal teams. And the third goal was really focused on creating standardized trainings across all the sites. And really there was an emphasis here on sharing information in a format and language that really felt familiar to the care providers. And for those of you who are not familiar with the term curbside consults, that's really embedded there in goal number 2. A curbside consult is really an opportunity to assess whether a situation with a patient is appropriate for a referral to a medical legal partnership legal team. They're also a chance to provide legal education in response to any questions the care providers may have about general legal topics. And typically the curbside consults would occur virtually and during MLP site team meetings, in a one-on-one setting, or when the MLP legal team participated in an existing case review meeting or rounds. So in addition to creating trainings that really focused on the 6 housing topics that are listed there in the slide, we also really wanted to focus on creating bite-sized, digestible 20-minute trainings. So the idea behind each training was that we would give healthcare staff just enough information to be able to spot a specific legal problem and then know what to do with it once they've spotted it. So if we can go over to the next slide, please. So what I want to do here is just give a quick overview of the project timeline and start to share some data points that we collected throughout this project. So from February 1st to September 30th, 5 MLP site teams collected data on 19 trainings. And through these trainings, we were able to reach 453 KP staff members, or Kaiser Permanente staff members. It's important to note here, though, that during this time frame, there was more than 19 trainings that took place, but we as the training and technical assistance team only collected data on 19 of the trainings that took place. And on this slide, what we've done is broken down those 19 trainings that we collected data on by the topics. If we can go over to the next slide, we'll continue with some data. So through this project, we really wanted to make sure to gather feedback to make sure that these standardized trainings were in fact helpful. So at the end of each training, what we did is we asked participants to complete a follow-up survey to provide feedback. And so through this survey, we received a total of 172 responses. And as you can see here, we have some data points that we want to share with you all. So about 91% of respondents reported that the training was actually relevant to the work that they were doing at Kaiser Permanente. Nearly 96% of respondents reported that the information in the training was actually easy to understand. About 93% of respondents said the training gave them tools and resources to really better identify patients who are facing the issues that they learned about. And then nearly 90% of respondents said that as a result of this training, they actually felt more confident in making those referrals to the legal team for the issues, the housing-related legal issues. So as you can see, overall, we received a lot of awesome and positive feedback, really emphasizing the usefulness of the trainings. So if we can go on to the next slide, we want to share that through this project, we actually also gathered qualitative responses, because those are just as important as quantitative. So through the post-training survey, we were able to identify a few things after gathering the data, which we collected through the post-training survey. And so we identified 3 key themes that are listed here, and so I'll walk through them with you all. One theme we noticed was that the healthcare staff really wanted to see more trainings. They found that they were very, very useful. And so as a result of this really positive feedback, the training and technical assistance team actually created 3 additional housing trainings that we've shared to date. So that was really exciting. Another theme here is that the training participants really appreciated having concrete scenarios and messaging around when to refer or when to do a curbside consult with a legal aid provider. And the third theme here, that's a mouthful, I'm sorry, was centered around staff being overwhelmed by various screening and referral protocols, making it harder to remember the information. So it's just important to note here that this theme wasn't really specific to MLP, but it did contribute to participants having a difficult time remembering the information they learned during these trainings. And so in addition to gathering feedback from healthcare staff, we also really wanted to make sure that we gave the legal aid partners who were conducting these trainings an opportunity to reflect and provide feedback on the training project. So if we go to the next slide, we can see here that the legal aid partners actually learned two key things. So one theme here is that legal aid partners shared that through this project, they really learned the importance of keeping trainings simple and digestible. And really, it was important to avoid using the legal jargon. So I'm going to read a quote here from one legal aid partner. They said, "It showed me that I still need to work on paring down what I want to say and resist adding more content than is needed." Another theme here, or another learning, was that we also heard from legal aid partners say that it was really important to focus on what training participants wanted to know versus what they want the healthcare staff to know or what they think they want the healthcare staff to know. So again, really catering the trainings to the learning needs of those who are going to participate or the healthcare staff. And if we go on to the next slide, we also heard from legal aid partners on how they actually might change their approach of non-legal audiences after participating in this project. So here on the side, we see sort of three key themes. So specifically, they shared that going forward, they would deliver all trainings in a similar way so that audiences can really become familiar with the format, so they can know what to expect when they jump into a training. And in turn, it really makes it easier for the audience to learn. They also said that going forward, they will share information simply in a very clear narrative with clear takeaways. So once you've spotted the issue, here's what you do, and people really appreciated that. And the third thing here is building trainings. It was really important for them that moving forward, they would build trainings around the audience they are for. So making sure to really use the language and the metaphors that align with the metaphors and language that healthcare staff use, and really avoid using the legal jargon. And so that's my last slide here, but to close this out here, I just want to share the key takeaway from this project is that we really learned that it's important to create bite-sized, digestible trainings for non-legal audiences that really meet their learning needs, because these shorter, more frequent trainings really keep important dialogue between partners going in a way that those longer, infrequent trainings just simply do not. So with that, thank you so much for allowing me to share these insights, and I'm now going to pass it back over to Kate.
Thank you so much, Ale. And again, keep those questions coming in the chat. I see quite a few of them. We'll get to as many of them as we can after our last speaker goes. I did just want to answer one quickly. That's more of a general question. I saw someone asked about whether or not the legal teams are on site at KP or whether it's virtual. This project started in the middle of the pandemic. And so these were being stood up initially during COVID, which presented some challenges. So all these projects started virtually, and now they are transitioning to be in person, in the sense that the attorneys are on site at KP offices. So it's a hybrid at the moment. It's moving more towards in person. So that's just to answer that one question. I also want to flag that Kyron put a link in the chat to all of the training materials that has the slide decks, the evaluation data, as well as a worksheet that teams can use to help create similar trainings. So this format that Ale really highlighted, these bite-sized trainings, but to do it for different topics that don't have anything to do with housing. And we often get asked, are folks allowed to use these? Yes, we encourage you to use them, adopt them, and adapt them, or however you might need to use them if it's helpful to your work. And now we can go to our next slide, and I'll hand it over to Shane Mueller to discuss the outcomes evaluation.
Thanks, Kate. Again, my name is Shane Mueller. I work at the Pierce Center in the Institute for Health Research at Kaiser Permanente, Colorado. And our team is conducting an outcomes evaluation of the MLP initiative. We collected a variety of data to do this evaluation. We collected referral data, data from our legal aid partners, survey data with participants. We conducted semi-structured interviews with them, and data from the medical record. I'm going to walk you through a number of evaluation questions and results, starting here with the reach of the initiative and some of the participation patterns. So some updated referral numbers as of April 2024. We've seen over 1,100 legal referrals made on behalf of over 1,000 unique KP members. 665 legal cases have been opened that are reported in our data, and of those, 481 cases have been closed. We estimate that up to 2,200 KP members have been reached by this initiative. That includes those people who were referred and an estimate of the people living in their households. Next slide, please. In terms of reach, the MLP initiative is serving a diverse group of members and participants. In terms of demographic breakdown, we're seeing majority of participants are female, and most participants were Black, followed by white, Hispanic, Asian, or Pacific Islander, and a smaller group of participants identified as another race or ethnicity. Next slide, please. The majority of members participating were over 50 years of age, but there was a diverse breakdown of age within the participants. Next slide, please. And members with a legal case ever open to receive legal services were primarily insured by Medicaid and reported an annual income of less than $50,000. Next slide, please. Among engagement in legal services, we saw that a number of services were offered. These services are categorized according to the iHelp framework developed by the National Center for Medical Legal Partnership. Again, the majority of cases were part of the housing and utilities category, followed by income and insurance. Next slide, please. As I mentioned earlier, at the time of our data collection, the majority of cases that were open had been closed. In terms of time required to close a case, most cases were closed with fewer than 5 hours of services provided. Additionally, the majority of cases received light touch services, such as counsel and advice of limited action, as opposed to more extensive services such as negotiating settlements or court decisions. Next slide, please. In terms of legal cases with recorded outcomes, a large number of those outcomes were related to housing and utilities. These included services such as providing advice and counsel on housing matters, negotiating move-outs to provide time for members to seek alternate housing, enforcing tenant rights, and preventing eviction. A smaller number of outcomes related to income and insurance, personal and family stability, legal status, and employment and education or employment. A large number of outcomes were reported as access rights to the justice system, effectively representing consultations with a lawyer, even if it did not lead to a specific outcome, such as enforcing tenant rights. Next slide. So moving on to some of the participant outcomes that we measured through surveys and semi-structured interviews. We had participants report that their connection to legal services improved their understanding of their legal rights and self-advocacy. One participant whose attorney could not join them on their court date was able to successfully represent themselves in court because engaging with the legal team had prepared them well. They commented, "Our attorney had told us so much that we were able to handle the case ourselves in court. Even the judge was saying, 'You negotiated this yourself? You've done better than a lot of other people would have.' And so our attorney gave us very good advice." Next slide. Another finding was that participants' satisfaction with Kaiser Permanente remained high throughout receiving services. Several interviewees reported that legal services improved their trust in KP and made them more likely to seek healthcare when needed. One participant reported that, "I've been reaching out to KP for more help, and at first, where I felt like helpless, I feel like now that I'm getting more help. My primary care doctor really helped me regulate. My pain level, where before I was like out of an 8 to 9 now is, say, like a 5 to 6. You know, like my pain's more manageable. Next slide, please. Participants also reported improvements in housing quality and stability. One participant who was living in a building with a cockroach infestation described their previous housing situation as unlivable. Working with legal aid enabled them to move without penalty. They reported, "We were able to move. There's no eviction or anything like that on our credit, or anything, nothing." They later shared, "It was embarrassing where we were living, because where we were. I couldn't go up and down the stairs to shower. Kaiser helped us move, and now I can shower, and now I can move around. Now I have a nice home for my children to play in the front of the back, in the front or the backyard." Next slide, please. Some interview participants did report positive improvements in physical or mental health resulting from resolving issues through legal aid. One participant who was waiting for a transplant reflected, "At the time that my legal issue was going on, I really had a hard time with my health. There were some days I wouldn't want to get out of bed or couldn't get out of bed. My weight went down to 115 because I was stressed. I wasn't eating or anything, and now my weight is back to normal. While it was 115, if I would have gotten called for a transplant, I wouldn't get it because you have to have a minimum weight of 130. But when I got out of that apartment and all the stress about it, I started to get better." Finally, we looked at changes in emergency department visits and hospitalizations among participants in the 6 months before the referral for legal services and the 6 months following receiving legal services. We found that emergency department visits per person decreased slightly, but this is not statistically significant. We also found that hospitalizations per person decreased from the time before they were enrolled in medical legal partnership to the time after, and this was statistically significant. This concludes a brief description of the outcomes evaluation. We're still in the process of evaluating this initiative, collecting more data, doing more analyses, and we look forward to sharing those results more broadly later this year. Thanks, and I'll hand it back to you, Kate.
Thanks so much, Shane. And I want to flag that Kyron shared a link in the chat to the Implementation and Outcomes Evaluation Report Executive Summary. That's all the data that's publicly available now. The full reports will be published early next year. The implementation evaluation is complete, and that data is being written up. And as Shane mentioned, the outcomes evaluation is still ongoing. So I want to turn to some of the questions that have been flying through the chat box with our presenters here. We can go to the next slide. And before I send questions over to our speakers, I just want to address one that came through the chat, which is that I know a couple people asked about protocols that allowed for information sharing between the healthcare and legal teams. And I feel like we could spend, a half an hour just talking about confidentiality and consent. So for that question, I really want to direct you to the resource that was shared in the chat, that consent and information sharing job aid really outlines the different types of consent, when different types of consent was needed, where it got documented. And so I really think that resource that Mallory Curran and others put together probably answers that question better than we could here today. So I want to toss the first question over to Marissa. Marissa, we had probably 6 or 7 questions in the chat that were really asking about the screening process itself. So I want to kind of wrap those all into one for you and just ask you to elaborate a little bit about how patients were identified. Was there a specific screening tool used? And how do the referrals actually get to the legal team? Are the lawyers in the EMR, or is it happening in a different way? So just anything you can sort of share about that screening process generally.
Yeah, thanks, Kate. And so the process for screening really happens on the front lines. Our frontline care team members that we partner with through the MLPs are really responsible for identifying patients who would be appropriate for a referral. And the tools that they use to help them sort of identify those patients are our Kaiser Permanente standard social health screening protocols that really screen across a variety of social health domains, including housing. And so that's sort of the first, I guess, clue to unlock whether or not a patient is experiencing some form of housing instability. And then through our things like ongoing trainings that Ale really dug into, and things like a smart phrase, they can sort of use those additional tools to really help them be able to identify whether or not a patient would be eligible for a referral or appropriate for a referral. And what we mean by smart phrase is really this sort of cheat sheet of phrases, literal phrases that a patient may say, or that you may sort of draw out in discussions with patients that are really just clues to identify whether or not a patient will be eligible for a referral. So for example, things like I received a notice from my landlord, or I feel discriminated against from my landlord. So if, these are sort of phrases that care teams can really sort of look out for to be able to assess whether or not that patient is eligible for a referral. So once a care team member is working with a patient, they feel that, this is an issue that they're dealing with that a legal aid lawyer could support with, they would then refer that patient to that legal team through a third-party social health referral platform that is owned by Unite Us. And so that information would go through that platform, and that legal team has access to that platform to be able to identify, who that patient is and to contact them to sort of find out more information about what their case is. So hopefully that answers all the parts of that question.
That's great. Thank you so much, Marissa. Shane, we've got a question here about the point in which you collected consent from patients for the outcomes evaluation. Was it something that was asked during the initial program intake, or was it something that came back and happened later? Shane, I think you're on mute.
Sorry about that. We collected some of that information from our legal teams among those patients who had consented to release their information back to Kaiser Permanente. Those are big sorts of data. We also collected some of that information from Thrive Local, the platform where referrals are made. We did talk directly to patients and surveyed them and obtained their consent to use that information, and then also use the medical record data from them as well. So that's there was a lot of different data pieces moving around, and there was a few different mechanisms that were used to obtain that information.
Great, thanks, Shane. One other question, I don't know if this is something that can be shared, but there was somebody in the chat who was asking about whether or not you have the structured interview questions from the qualitative research and whether or not those can be shared or not.
Sure, we do have those. I'm happy to share them. We are looking at sharing some of those results more broadly in the future, and would love to share more of those quotes. What I shared with those quotes is only, scratching the surface of what we heard in a lot of these interviews.
Thanks, Shane. It sounds like as all of the data gets written up over the next year, there's going to be a lot more of that information that's available. I see a lot of questions coming through around the evaluations about specific types of legal cases and whether full representation is available when only brief service was done. I just want to acknowledge that I'm seeing those questions, but I'm actually going to hold them for when we get to our frontline providers, because I think that our attorney on the call might be able to answer some of the questions about the availability of services better than our eval teams here. Marissa, I want to come back to you for one last question. I'm realizing that we probably should have stated this at the beginning, but there were a couple of questions just about the origin of this initiative and how the specific sites got selected. So, there are 6 sites. How did the specific KP sites get selected, and those legal partners, and how is that has the initiative funded?
Yeah, thanks so much, Kate. So the initiative is funded through the Kaiser Permanente Fund at East Bay Community Foundation to fund the 5 legal aid organizations and help them build the capacity of the broader legal aid ecosystem, as well as to develop the MLPs that were focused on housing stability. And I think, there was a question about sustainability. That is something that we are actively identifying, funding mechanisms to sustain this into the future and to look for opportunities to really scale this work across additional KP regions. And I think in terms of how the legal aid organizations were identified, if that was your question, we worked in partnership with the training and technical assistance team, so folks at the National Center for Medical Legal Partnership and Health Begins, when this initiative essentially first launched, to identify legal aid organizations that would be well positioned to be sort of partnering in this way. And so we sort of matched that assessment up with our regions who were really equipped with some of those screening protocols and who were sort of, willing to go down this sort of journey with us and test this model of intervention within our broader healthcare system, because this, was launched during the pandemic. And so it was sort of marrying of those two willing parties and sort of that assessment of readiness on the legal aid side as well.
Awesome. Thanks so much, Marissa. And this is a quick answer, so I'll take this one, but there was a question about whether KP used the Unitas Network Hub, a case management service, a different third-party platform. And Kaiser Permanente uses Thrive Local, which is a specialized version of Unitas. And so that was actually one of the, really big first initial steps was making sure that all the legal services providers were in Unitas, and that has been continued to be used throughout the length of the partnership. So I'm going to pause questions there. For the ones we didn't get to, like I said, I've been looking at some of these, and I think they may be more appropriate for folks coming later in the session. So I just want to say a huge thanks again to Marissa, to Alejandra, and to Shane for sharing this information with us and being here today. So I'm going to, now that we've heard about the data, we're going to hear a little bit about the program from some of the people involved in running these medical legal partnerships on the ground every day. So if we can go to the next slide, we are fortunate today to have 3 frontline practitioners representing both different medical legal partnership roles and also different regions here today. So we have Lynette Namba, who is a community health consultant with KP Colorado. We have Gerson Sordo, who is a supervising attorney with Neighborhood Legal Services of Los Angeles County. And we have Michelle Villavicencio, who's a Medi-Cal social worker with KP Northern California. So grateful to all 3 of you for being here today. For this section, we're actually going to take a break both for our speakers and for all of you joining us from our slide deck to have a little bit more of a fireside chat kind of conversation. So I have some questions prepared in advance for our speakers, and then we're going to have time again, just like we did with our data folks, to answer your questions. So again, keep those coming in the chat throughout. There's no need to wait and hold them. So Lynette, Gerson, and Michelle, I'd love to have you start by having each of you introduce yourselves and share a little bit about your role with the local KP Medical Legal Partnership. So sort of how you're involved, what you do on a day-to-day basis. And let's go to Lynette first, and then we'll go to Gerson and Michelle.
Hi, everyone. I'm Lynette Namba. I'm part of the community health and relations team at Kaiser Permanente in
She's really
Colorado.
broken up.
My role has really been
hold on one second, Lynette. If you can hear me, your audio is really cut up.
Expertise to inform and support medical legal partnership implementation and to identify. Oh, am I? Can you hear me okay?
You're sounding much better now, but you are really breaking up. You may need to call in.
Boy.
If you want to try to call in by audio, we can go to Gerson, and then we'll come back to Michelle. And you can also turn your video off. It may be killing your bandwidth. But okay. Gerson, let's go to you, and then Michelle, and we'll come back to Lynette.
Thanks, Kate. Yeah, I'm thrilled to be with everyone today. So I'm Gerson, as you mentioned, with Neighborhood Legal Services of Los Angeles County. I lead our firm's medical legal community partnership initiatives. Over the years, that's included establishing a county-wide medical legal community partnership within our county departments of health services and mental health. And I'm honored to work with a team of passionate advocates that serve patients and integrate within our clinical partners. Early on, I was able to work with a lot of the teams here within KP that we're launching and offering some of the insights that we learned throughout the years in Los Angeles. And we're actually celebrating our 1 year birthday at KPLAMC this month. And I also wanted to shout out Elisa Carino, who's been the attorney on the ground, who's been really implementing and engaging with the clinical teams at Kaiser. It's great to see you all today.
Thanks, Gerson. Michelle, you want to jump in and introduce yourself and your role with the MLP?
Yeah, hi everyone. So nice to be here. So I am a licensed clinical social worker from Kaiser Permanente. I recently transitioned to a new role, but I'll be speaking to my last 7.5 years at Kaiser as a frontline social worker working for the Kaiser Medi-Cal Care Coordination Team. On that program, I did a variety of different things, but mostly was doing a lot of initial assessments, and really that's where we would get a lot of our referrals from, is really digging into seeing what's going on with our members, what kind of issues are they facing, and from there kind of determining what resources or programs we would refer them to. So it's a great program, and I'm excited to be here.
Thanks so much, Michelle. And Lynette, you're welcome to keep your video off. Do you want to try your audio again here? All right, Lynette may be calling back in separately. So we'll actually just move on to our first questions. And then when Lynette joins us back, we'll have her introduced before she starts answering some of her questions. So Michelle, I'd actually love to bring the first question to you. So as a social worker and a case manager, I'm wondering if you can share a little bit about what life was like before and after working with legal services and MLP. So that can be, reflecting on what's different for your patients, but also like what's different for you.
Yeah, great question. So life before the MLP partnership. So like I said briefly, I did, my role was to do a lot of assessments. And so imagine, someone comes to you in a crisis, housing issue, like they're being evicted, or somebody, has mold in their home and the landlord isn't addressing it. I would just give them a resource, like say, here, contact this local legal agency. And really hope that they were able to get in touch with someone in a timely manner. So that sometimes it happened and sometimes it didn't, just based on, what was available, because there's not always a lot of people able to help our members, especially in a timely manner, like when they're having evictions. And so that's what it was like before. It was kind of like, let's hope that they get in touch with somebody. And of course, my role would be to advocate for them too. But things really changed when the partnership happened, because I was able to have direct access to attorneys that can give us a lot of education and support around the members' needs. And the timeliness was important too, because our members were getting these notices that required someone to, they needed to reply within 10 days or 3 days. And so there was a big difference from before and after. Before, it was like some members were able to get help maybe, and some weren't. So then you had people become homeless. And we've seen that, and we're still seeing that. But I have personally worked with many members who were able to, the eviction was avoided because there was intervention, there was help. Maybe there was a delay, maybe the attorney was able to, hey, let's work this out. And these cases are, they're ongoing. They're not one and dones. So it's for me to say, like, I made a referral and it was just, that was the end of it, the case was closed. No, it's not like that. Sometimes we're making ongoing referrals. We're making more than one referral about different issues that come up. There's a case example that I could think of a young member, 6 years old, who the doctor made a referral to me because she was having asthma exacerbations, and there was issue of mold, and that wasn't being addressed by the property manager. So I made the referral to legal services, and they're still supporting that family But with the support, they were actually able to help the mom, because they lived in public housing. They were able to help the mom get her $5,000 back that was like missing from her housing account. So she had told me she struggled. She was like wondering where this money went. She didn't have any help. And so the legal services team was able to help her get that money back. And so I still have had contact with the mom, and mom is still trying to find a place to live. But that $5,000 can help her get into somewhere else, you know, when the time comes. And while there's still ongoing issues with trying to figure out the mold and the property manager fixing it up, without that support, I mean, we would see, you know, it could have been that she gets evicted. She never got that money back. This partnership really gives our members a voice in the community. So it's just very essential. You know, it's been really wonderful.
Thanks so much, Michelle. Gerson, I want to come over to you next. One of the pieces of data that Shane Mueller shared today was that the most common way MLP lawyers helped KP patients was through what he called brief advice and counsel, or brief service. And for those of us who don't work in legal services every day and who aren't trained as lawyers, can you give us an example of what brief service looks like, the difference between that and other types of legal services, and why each are valuable?
Definitely. Brief services or counsel and advice typically involve a lawyer providing immediate assistance related to a patient's issue. So these are shorter interventions, but they're still very impactful. I actually have a story. I thought we'd talk about Emily. So she was referred to MLCP because of a potential eviction. And Emily was blindsided when the on-site manager told her that she needed to pack up and leave her rent control apartment in 45 days, despite her being a perfect tenant who paid her rent on time and followed all the rules. And, this understandably left her in so much distress. She had anxiety and depression already, and that worsened. She was thinking about how on a fixed income and limited mobility, she had such daunting challenges up ahead. She had to find a new place to live that was affordable. How could she actually go out and look for new apartments? The viewing itself was burdensome. And the logistics of packing our apartment and moving, it was too much. And she was worried that, becoming unhoused was a real possibility. And that would mean losing her belongings and access to essentials like a fridge to keep her insulin. So for the MLCP attorney, when they got the consult, the illegality of the issue was really obvious, right? Her unit was in a rent-controlled location. She had just cause protections. It was clear that the landlord didn't have a legal basis for evicting her. Additionally, the notice was given verbally, and a lot of the other rules weren't followed. And most importantly, the landlord couldn't go in and change the locks on their own or compel her to leave. Only a judge could order that after hearing the case. So after consulting with the MLCP attorney, Emily was so relieved that her housing was safe and she could focus on her mental and physical health. For others that move out, though, unaware of the protections available to them, like, Michelle mentioned, not everyone is able to know and connect to legal services. For those people, the outcome is starkly different. So brief services are valuable because they offer acute legal interventions that can have an immediate and substantial effect. But let's think of it this way. So when a patient feels sick and goes into urgent care, there's a triage nurse who evaluates their chief complaint, the conditions and the vitals, and then they'll meet with a provider who examines the patient and offers a treatment plan that can range from, go home and rest to here's some antibiotics prescription, pick it up on your way out, or we need to get you hospitalized right away because you have an emergent issue. So for us, we see our intake as a legal urgent care checkup. So we assess, we diagnose, and we develop customized legal action plans for each client. Brief services address immediate legal needs, but those extended services involve more in-depth legal representation and advocacy, like an extensive negotiation with the landlord, administrative agency complaint, or litigation. And we heard about, averages and an average, case closing within, 5 hours or less. Some of these extended cases could very easily run 60, 70, 80, or 90 hours for one individual. And then as we work through these cases, we also identify other systemic issues that also might rise and require more strategic and broader intervention. So I definitely, see brief services as an important part of this continuum of care that includes extended services and other ways that we're able to serve our clients.
That's really great. Thank you so much, Gerson. Lynette, I'm just checking to see if we have you back. If we do and you're able to unmute, please let me know. All right, Michelle, then I have another question on deck for you. You talked a lot about your role as a frontline social worker and a frontline case manager and how that, has interacted with the MLP, but you've also been a part of helping to get this initiative set up off the ground. And I'm curious, if you were speaking to your peers, to other social workers, other case managers, what kind of lift is this? Is this a heavy lift to get it set up, to get all the processes in place? What was that experience like for you? And ultimately, is that experience worth it?
Yeah, so I will just say, yeah, it was a heavy lift, but I feel like teamwork is, the dream work, right? So I had like we have an incredible team, and everybody just had different level of expertise to bring to the table. And with great partnership, it was actually, I felt like it was a very fun process. And it was exciting to be able to, as a social work, like from a social work point of view, it was excited to know that like there was going to be a resource like this available, like this accessible, like something I can share with my members that I knew was going to be so beneficial. And especially during the time when it first came out, we were getting eviction referrals like left and right, and it was like perfect timing. So I will say that if you have a great team and everybody's willing to work together, it's a great process. And in the team, and when I say team, I mean like the team Kaiser, and I mean the team with legal services in Northern California. Everybody really had the same goal in mind, which was like, how can we better support our members? So I have learned a lot. I feel like since the beginning to the end, actually there's no end. We're still going, but I have learned a lot. It definitely has increased my knowledge around legal, just like, for example, a member may come to me with some kind of housing legal issue, and I might, initially would have been like, oh my gosh, this needs to be addressed like immediately, but then come to find out after trainings and learning, well, actually they have 10 days, but it was comforting to know, oh, I can send an email to Katie, and she can let me know that, because I'm not an attorney. So yeah, I feel like the lift was heavy, but it was fun in the process. So I, have nothing but good things to say about that.
Great to hear, Michelle. Okay, I think we have Lynette back. Lynette, do you want to unmute and just introduce yourself a little bit and say what your sort of day-to-day role with the medical legal partnership is? I think you're still on mute, Lynette. All right, we'll circle back one more time at the end to see if we can catch her. Gerson, another question for you. These were actually flying through the chat box while Shane was presenting. There were a lot of questions about the sort of specific cases, noting that, this is a housing, health, and justice project. So most of it's focused on housing, but there were several cases. There were just a handful of cases that were SSI, SSDI, a couple of family law cases, and that were like floating around other topical areas. And a couple people were just asking, how did those sort of cases slip into the project? Were they ultimately housing related? Or can you just sort of paint that picture for us?
Yeah, early on with our partners at LA Medical Center here locally in SoCal, they were really great at working together to figure out what should our scope of services be. We know that there are many cases that are very obvious housing cases, right? Someone has an eviction notice, someone has substandard housing conditions, but we really wanted to, as we all are looking at those upstream interventions, and we were able to kind of work with them to develop a menu of services that were definitely beyond strictly housing, but impact housing, right? So what are the issues that are impacting someone's risk of becoming unhoused, impacting their income, impacting their access to food, impacting their access to healthcare benefits, access to safety at home. So those are kind of like the major categories of issues. So when someone's referred, we might get a referral for, like the hypo I gave with Emily. It could be a very specific housing issue. And when we talk to the patient, we do a comprehensive screening to understand, you were referred for this particular housing matter, but it turns out that there are a couple of others. Your local social services agency is denying your CalFresh application or TANF for some other benefit, or perhaps your Medi-Cal is being cut off or Medicaid is being cut off. As we were transitioning out of the public health emergency, that was a big risk that many patients were at risk of. So, we're really grateful for the team as having a holistic view and allowing us to really take that very broad approach into serving our clients and the issues they present with.
Awesome. Thanks so much, Gerson. There was just one more clarifying question. I think, we have a lot of people who are legal folks and a lot of people who are healthcare folks. And folks were asking, does closed simply imply, does it imply, if a case is closed, does it imply anything about success for clients?
I'd say there's value in every interaction we have with a patient. Closed means that for that particular matter, we're no longer taking additional action. So as I mentioned, right, so there might be multiple cases. It doesn't mean that we're not working with the patient. It just means that for that particular matter, our service has concluded.
Great. Thanks, Gerson.
Can you hear me now, Kate?
Yes, we can, Lynette. So if you want to go ahead and introduce your role on the MLP, that would be great.
So sorry, everyone. Hi, I'm Lynette Namba. I'm part of the Community Health and Relations team at Kaiser Permanente in Colorado. My role has really been to bring regional expertise to inform and support MLP implementation and to identify collaboration and funding opportunities.
That's great. And Lynette, I'm actually going to send a question right over to you while we've got you. We heard during Alejandra's presentation about some of the great training work that's being done on the healthcare side to help them better understand sort of specific housing issues and when to refer them. But we know as a partnership, right, that things go both ways. And I'm wondering if you can share a little bit about sort of what the training needs are for the legal team. Like, what does the healthcare team have to teach the legal team? And are there examples of those types of trainings that you've been doing in Colorado?
Absolutely. So yes, as previously shared, the legal teams have provided many trainings for the care teams. So a few months ago, it was brought up that the legal team might also benefit from trainings delivered by the care team. So as kind of a pilot, just a few weeks ago, Dr. Jennifer Keloff, one of Kaiser Permanente Colorado's pediatricians, provided a training on trauma-informed care to our legal aid partner to provide some tools for attorneys when working with clients who may have a history of trauma. Nearly 3/4 of the Colorado Legal Services staff attended this training and had very positive feedback. Dr. Keloff provided an informative and engaging training on the subject, soliciting feedback and encouraging sharing from the group. As an inherently challenging topic to breach, she recognized the possibility that the trauma discussion could be triggering for the audience and gave permission for them to pay attention to that and to take care of themselves, a through line through her presentation. In her kind and gentle manner, Dr. Keloff talked about not worrying about having all the answers, but listening and responding with empathy, making a shift from what's wrong with you to what's happened to you, and resilience as the antidote to individual, community, and environmental adverse conditions. She gave tips for how to avoid re-traumatization, counter compassion fatigue and moral distress, and gave many examples of tools for self-care and self-compassion, emphasizing that staff who practice mindfulness and self-compassion are better able to serve their clients. The training was well received and there was a lot of great audience interaction. Several attorneys shared their own self-compassion tips and ways that they have worked with clients using a trauma-informed lens. For example, when going to court, talking a client through what to expect when going through security and where to meet. As you might expect, the Colorado MLP team has learned that attorneys and clinicians speak different languages and have their own jargon, acronyms, and slang. And so does Kaiser Permanente. The trauma-informed care training allowed the care team to share their expertise and reiterated the need for reciprocal understanding among all MLP parties.
That's awesome. Thank you so much, Lynette. And I actually, the Colorado team was nice enough to let me be a fly on the wall during that trauma-informed care training. I always feel like as a storyteller and a communication person and literally anyone who has any contact with patients, clients, or frankly, just other humans, trauma-informed training is like, we all need it. And one of the things I wanted to highlight too about that is that KP opened that up not just for obviously the MLP attorneys who work on that project, but for the entire legal aid office. So that training was provided to all of the attorneys and paralegals and staff who work at Colorado Legal Services, which is really exciting and a great opportunity for that. Kirsten, I want to go back to you for just a second. If any, sorry, I've been seeing a few questions floating around funding and long-term funding considerations in the chat. And I'm curious from your perspective, how you think MLP can become further integrated into Medicaid.
Thanks for the question, Kate. So, we call the medical legal community partnerships, really emphasizing that importance of community. And those are, as we've seen, right, a really transformative model that's vital, I think, as a component of holistic patient care. I want to try to highlight two primary avenues through which I think Medicaid can support MLCPs directly, and then also offer two additional observations. So first, state plan authority allows states to define Medicaid covered services, including preventive services that could encompass MLCP activities, even where states don't specifically name MLCP or legal services within that state plan. Many provide for case management or social service coordination, which could be leveraged to incorporate legal services in MLCP. So definitely that's one opportunity. Second, and I think most exciting to me is Medicaid waiver authority. And that enables states to test innovative service delivery systems that improve care and increase efficiency in a cost-effective way. And states use waivers to do some really exciting things. So for us, for example, Medical Legal Community Partnership Los Angeles, known as MLCPLA, is a project led by MLSLA that unites 4 legal aid programs to provide county-wide legal help to patients of the LA County Department of Health Services and mental health. And in 6 years, MLCPLA has helped over 12,000 people with over 17,000 cases, securing access to food, income, health, and safety. While we're now funded by other income sources, MLCPLA got its start through the state's 1115 Medicaid waiver called Medi-Cal 2020 or Whole Person Care. And Medi-Cal now has a new waiver. They describe it, and it's known as CalAIM, and they describe it as a series of waivers that are set out to transform and strengthen California's Medicaid program to make it more equitable, coordinated, and person-centered. And they're really focusing on prevention and even specifically addressing the social determinants of health. And legal services aren't explicitly included there, but there's potential for their inclusion in the future. As to sort of my two broader observations, first, free legal help is as vital to healthcare as other medical care, like primary care visits, specialty consultations, or an ED visit, because they enhance health by facilitating access to housing, food, income, safety, and stability. And legal services could be recognized as an essential health benefit, which would include expanding Medicaid's definition of preventative services to include MLCPs or legal aid. Secondly, further work could identify a path for funding legal services through Medicaid value-based payment models that already reward the provision of comprehensive care. And I think this approach really aligns with Medicaid's goal of improving health outcomes while controlling costs. NLSLA has a long-standing tradition of cultivating strong working relationships with elected officials and decision makers. We educate them on the services we provide to their constituents and the difference that those services make in their lives. These meetings result in leaders seeking our expertise to analyze legislation that they draft to meet their constituents' needs, including in healthcare and Medicaid funded services. And we do all this work in compliance with LSE rules. To close, really incorporating MLCPs into Medicaid, I think marks a natural progression in this really model of person-centered care. And I really want to applaud KP for its investment and leadership in this space, along with all of the partners, co-presenters, and supporters on this panel and in the audience today.
Thank you so much, Gerson. And thank you so much, Lynette, Michelle, and Gerson, all of you, for being here. I mean, you are really on the front lines. You have been doing the work, and all the data we heard about and all the results that we hear about are really because of the work that you three and the folks like you at all 6 sites have been doing. And just so grateful for your time today. So thank you so much. Before we go on to our next session, I just wanted to address one quick question that came through the chat, and we didn't we did get to audience questions in this section. I just naturally folded them in, and so I've been trying to ask as many of these as possible. But someone asked about whether or not we've been sort of going around to the medical community to share some of these results, and the answer is yes. We've been going to conferences, online spaces, et cetera, for all of these groups, the medical communities, the legal communities, et cetera, to share some of these findings, and that work's going to continue, and it's going to continue as we move towards publishing a lot of the evaluation findings. So if we can bring our slide deck back up, we're going to go into our last section here. And we're really going to talk just a little bit about where we go from here. So we've heard a lot about the initiative at Kaiser specifically, and we want to zoom out a bit and think about medical legal partnership broadly, and how it can be sustained and scaled. And so I'm delighted to welcome our final 3 speakers who are going to reflect on that question. And I saw several people in the chat asking, like, how do we talk about this work in a broader way to policymakers who are making decisions? And I think this is the group to really answer those questions. So by way of introduction, we have Bethany Hamilton, who is the director of the National Center for Medical Legal Partnership. We have Ronald Flagg, who's the president of Legal Services Corporation. And we have Vanessa Davis, who's the director of Medicaid at Kaiser Permanente, and who was formerly the national program lead for housing at KP, where she really spearheaded the launch of this initiative. So with that, Bethany, I'm going to hand it over to you.
Thanks so much, Kate, and thank you so much for everyone who really set the stage for us to be able to close out today with some motivational remarks. So as you all know, since 2006, the mission of the National Center for Medical Legal Partnership has really been focused on creating an environment where MLPs could thrive. And our goal continues to be to elevate MLPs from being a mere innovation to a transformation. Our goal, our vision, related to that goal is a future where medical legal partnership practice is not just a project of the partners that get engaged in this collaborative activity, but really is driven by this courageous change agent approach that makes MLP a standard practice for achieving health equity and justice. So as we've heard from the speakers that came before me, the KP Health, Housing, and Justice Initiative is a really exciting first of its kind initiative that was inspired by and really builds upon a robust medical legal partnership movement that has been around for at least 3 decades. So like many of you who are tuning in and those in the field, to our MLP practitioners, as well as the vanguards of this particular project, you represent a diverse group of professionals and organizations who chose to collaborate to be able to enhance and strengthen the impact of your local efforts. As we continue this important work, as many of you have already begun to ask about in your questions that are coming through in the chat, the question of sustainability and scalability is always at the forefront. To help us begin to answer this question, I'm now going to pass it immediately on to national leaders, Ronald Flagg of the Legal Services Corporation and Vanessa Davis of Kaiser Permanente, to talk about the urgent need to scale medical legal partnerships and the opportunities that we must seize upon to sustain this evidence-based approach. First, Ron, I'll pass it on to you.
Sorry about that. Thanks, Bethany. I'm been very excited to hear the presentations that have just been presented and to be participating in this conversation. Again, I'm Ron Flagg, president of the Legal Services Corporation. LSC is the largest funder of civil legal aid in America. We grant out over $500 million annually to 131 legal aid programs, operating over 900 offices throughout every state and territory in the country. And last year, LSC grantees served over 2 million individuals, including over 800,000 children. About 40% of these cases handled by our grantees involved housing issues, and housing issues have surged as a result of the pandemic and its economic aftermath. Now, that all sounds pretty good, but notwithstanding these figures, and despite our nation's commitment to justice and to legal aid via establishment of LSC, the fact is that the vast preponderance of people who cannot afford a lawyer do not receive legal assistance, no matter how important the civil legal issue they face. LSC's 2022 Justice Gap Study reported that 92%, again, 92% of the significant civil legal problems faced by low-income Americans receive no or inadequate legal assistance. This gargantuan justice gap pointedly tells us that the status quo is not okay, and it demands that we develop new approaches to the delivery of legal services to those who cannot afford a lawyer, and for that matter, to those who are just above the financial line to get free legal services from our grantees. At LSC, our own perception and that of our allies and partners is that we must leverage legal services by collaborating with providers of other services, such as healthcare and social services, exactly the folks that have been making presentations today, in order to reach people in need where they live, in their community gathering places, or where they access other services. We must reach way outside of our traditional justice partners, law firms, law schools, and courts. They remain important, but we need to see beyond our silos to existing, powerful community partners and organizations that share our goals and our values, if not, as has been described, our language and training. At LSC, we have already seen over the last 6-7 years many examples of the effectiveness of medical legal partnerships. And just in the last hour, we have heard additional impressive data and stories. We believe deeply in this approach. We believe deeply that we must drive our efforts and impacts further upstream with our healthcare partners. When we anchor our specialized legal expertise deeply in healthcare organizations and functioning, we can prevent, or at least remediate early, many of the problems that are part of our mission, LSC's mission, to address. To be successful, though, we must dedicate our resources and expertise to this special practice and value it commensurate with the impacts we are seeing, many of them presented today, in the communities we serve. To do this requires vision and strategic commitment, and I underscore the word strategic, of legal aid leaders and their staffs and boards, so we can achieve true people-centered justice. I believe America's legal aid providers are eager to tackle this challenge and integrate medical legal partnerships as a core part of how we achieve justice. LSC is committed to lead this transformation. And I want to thank Kaiser Permanente and all of you for the work you are doing and for the opportunity to join you in that.
Thank you so much, Ron. I think we can hand it over to Vanessa next.
Hello, everyone. Thank you so much for being here today and for hanging with us as we round out the end of this really phenomenal webinar and series of discussions. My name is Vanessa Davis, and I am a director on the Medicaid team here at Kaiser Permanente. I am thrilled and honored to be a part of this webinar today that really discussed some of the preliminary impacts we're seeing across Kaiser Permanente's medical legal partnerships. I wanted to share more about how Kaiser Permanente committed to this work for the long term and really where we might go from here. So we at Kaiser Permanente believe that if we can prevent evictions, we can make a meaningful difference in people's lives and a measurable improvement in their overall health. We're already seeing that. Our MLP model is truly changing lives. And preliminary findings, as we heard, indicate success with the MLP model, including improved housing quality and stability, as well as improvements to people's physical and mental health. Given what we now not only intuitively know, but have the evidence to support, we must continue to find ways to sustain and further scale this critical work. So leveraging our positive preliminary evaluation insights, Kaiser Permanente is prioritizing opportunities to further embed this transformational model into our standard of care. We need more partners in public health, housing justice, and legal sectors to prioritize funding these highly specialized and effective preventative resources that can change the trajectory of people's lives. Legal Services Corporation is a critical part of that puzzle, and we know that other federal agencies like HRSA, the VA, and others are investing in building MLPs. Moreover, there is increasing attention and momentum across state and federal Medicaid policies and programs to prioritize innovations that address health-related social needs and advance health equity. The California Department of Healthcare Services recently made a bold mandate to transform Medi-Cal, the state's Medicaid program, ensuring that all Californians get the care they need to live healthier lives. Medi-Cal members now have access through new and improved services to get well-rounded care that goes beyond the four walls office and addresses their physical, mental, and social health needs. These changes are part of a broad transformation of Medi-Cal to create a more coordinated, person-centered, and equitable health system that works for all Californians. Kaiser Permanente recognizes that there is significant opportunity to seize this moment of transformation and explore how might we identify long-term sustainable funding for this work to put health equity and population health at the forefront. We're eager to continue to highlight Kaiser Permanente's unique approach to legal services provision to unlock opportunities and make the case for sustaining this work in the future. Thank you so much. And with that, I'll pass it back to Bethany.
Thank you so much, Vanessa, and thank you, Ron. I have the difficult now task of topping that. I don't actually attempt to do so, but hopefully we'll close out with a note to help people know what to do next, where to start. The message really is clear. The people we all aim to assist, the services that we seek to provide, and the goals that we really desire to achieve here together require working collectively in order to be more effective. But we also understand that systemic change, that transformative and sustainable change that we're trying to achieve often happens incrementally. So as a very first step, we're asking everyone to just start by imagining the ability to learn and practice without barriers. Very quickly, just imagine if MLP were a standard part of every academic and training curriculum: medicine, public health, law, public policy, business, and technology. Imagine if we had a more seamless integration of our EHRs and EMRs, and then the legal case management software that we use. And imagine if AI advancements could help accelerate this. Imagine if ethicists on the legal and on the healthcare side and bioethicists would highlight MLP practices as a model of serving clients and patients' best interests. Imagine, hint, hint, if you could find some free peer-approved and vetted resources for implementing your medical legal partnerships. Imagine if sustainable funding streams included Medicaid financing and made it available not just for the healthcare side of the equation, but especially for what we're trying to integrate here, which is the legal services. We're seeing this happening in North Carolina, California, and several other states around the country. Imagine if our federal government were to adopt a system-wide, government-wide medical legal partnership approach so that we could enhance capacity, improve equity, increase taxpayer dollar effectiveness. Think about if HHS were to declare legal care as healthcare, CMS were to recognize MLP as a healthcare model, if ONCIT were to partner with other federal agencies to enhance the impact of our approach. Imagine if one day MLPs were to become the normative, making the term itself completely unnecessary. Imagine that. The second step after imagining that is taking action. Understand your patient's needs and barriers. Connect with your local legal services providers, as the Kaiser Permanente project folks did early on into the development of this project to better leverage those legal services partners' expertise. Use the roadmaps, in other words, the tools that have been created by these partnerships that have been operating for 30 years, and then the newest of the partnerships that are being run by Kaiser Permanente and others to really implement and advance your own medical legal partnership approaches. And then help and join us by advocating, and if you can't do the political advocacy, at least do the education and the storytelling that will help us to advance those policies that foster the MLP growth, impact, and sustainability that we're trying to achieve together. Kate, I'm going to pass it on to you, but really thank everyone, including our audience, for joining us here today to learn more about this approach.
Thank you so much, Bethany, Ron, and Vanessa. It was so wonderful to have you here. I know we're at time, so if you need to hop, that's great. But I am going to take just 2 minutes to point us back to some resources and do some really quick wrap up for those of you who are able to stay with us. So let's go ahead. Oh, we're already on the slide. Great. So as we close out, I want to direct you to also some resources. So I know they've been flying in the chat box today, but here are 3 things that to look for. So this first one, and these links are also being shared in the chat as well as these QR codes. So this first page has actually all the resources that we've talked about today in one single place. So this link is great for going and finding all of those resources. And Kyron, if we want to put that back in the chat again, that would be great. If you leave today's webinar and you have burning follow-up questions about this initiative or anything that you've heard today, I want you to encourage you to reach out to Ellen Lawton, whose email address is on this slide. You didn't hear from her today other than in the chat box, but her work was certainly felt throughout our discussion. She's a senior fellow at Health Begins and also our training and technical assistance director on this project. And then lastly, if you want to connect more broadly with the medical legal partnership movement, I really encourage you to sign up for the National Center for Medical Legal Partnerships newsletter. And then let's go to our last slide. So after today's training, you are going to get a link to a very brief, and when I say brief, I mean 3-question survey about today's webinar that we hope you'll complete. And we will also follow up with an email with a link to the webinar recording as well as today's resources. And with that, we are at the end of our webinar, and I just want to say a huge thank you to all of our speakers. And on behalf of Kaiser Permanente, the National Center for Medical Legal Partnership, and Health Begins, I want to thank you all so much for joining us today, and I hope you have a good rest of your day. Thanks, everybody.